Hi, I'm Dr. Vineet Malhotra. I'm a urologist and andrologist, and I specialize in microsurgery for male fertility. What that means is that I do procedures that help males to get fertility where couples are struggling for fertility outcomes, and we help them with procedures that may help them retrieve sperms where sperms are not found in other ways. Whenever we look at sperm retrieval, it's required for a condition known as azoospermia, which is when there is no sperm production or no sperm found in the ejaculate. Now, that may happen because of obstruction, which is corrected or sorted by simpler procedures, which can be done using a needle, such as TESA, or a epididymal sperm extraction, which is called PESA. But when that is not an obstructive cause, these needle procedures fall short and the retrieval rates drop to as low as 10%. These can be because of genetic defects, these can be because of hormonal impacts, or in a lot of men, just unknown causes that do not allow sperm production to happen. Now, if that's happened, most men would have thought there's nothing that can be done. In fact, that was the belief for a very, very long time. Nothing could be done then. Then a change happened. So, somewhere in the late 90s, a brilliant surgeon by the name of Peter Schlegel devised a procedure called MicroTESE. MicroTESE means microsurgical sperm extraction from the testes. And that was a procedure which changed outcomes drastically. Now, by this procedure, what would be done is that we would open the testes within the scrotum and then examine these sperm producing tubules individually under high magnification. There's a reason that that is done, because if it is sperm producing, then the tubule tends to be larger in size and it also becomes darker. So for a trained surgeon, it is then easier to differentiate that sperm producing tubule from the surrounding non-sperm producing tubules. And that would change the outcomes, because you could actually map the entire testes. You would need to do it safely so that you wouldn't take away the blood supply of the testes and damage it. But if you do it appropriately, then you could then find these tubules by examination rather than the blind needle aspiration, which is the nature of a percutaneous procedure where the needle is punctured from the skin. When this started to happen, our retrieval rates completely changed. From a retrieval rate of 10% for needle procedures, we reached a retrieval rate of almost 40%. In fact, in some cases, up to 60%. There are conditions, we call them hypospermatogenesis, or where the sperm production is suppressed quite tremendously, but it does not go away, where you have these small focal areas of sperm production within the testes. So you have a higher chance then of finding them under direct examination. So the procedure then allowed us to do this. I'll tell you about one of my patients that actually is now kind of a person that's my mascot, because he talks about me every time. He was from Kenya, came in for the sperm retrieval procedure, and he had a condition called Klinefelter syndrome, which is a genetic condition. Now, in this condition, the testicles become very small and the hormone levels go haywire. So his FSH, which is one of the hormones that marks your spermatogenic potential, was way off the charts. He'd been told at most places that there would be no use in trying to find sperms, and he came to us and we suggested that we may attempt MicroTESE. We know that in MicroTESE for Klinefelters, we had retrieval rates between 25 to 30%, and we counseled him as such. He was sure that he did not want to use donor sperm, and hence he opted for the MicroTESE procedure. We found 3 sperms on MicroTESE, 2 of those fertilized, and he has twin daughters. It's a story which is difficult to believe, but that's the outcome that we had. He's actually named one of his daughters after me, which is like the thing that you work all your life for. And this outcome would not have happened without MicroTESE. So MicroTESE completely changed what would have been his outcome otherwise. Hence, when we need to retrieve sperms for men with non-obstructive vasospasm, MicroTESE becomes a very useful procedure. Does it have any preparation? So we need to have optimization done before we do a MicroTESE procedure, because it is a one-time procedure. It is an invasive procedure. You don't want to do it again and again. So hormones should be optimized. If there is a varicocele with the present condition and it is a large varicocele, then that must be treated. If there is any infection or any other factor that may affect sperm production, that should also be sorted before we do the MicroTESE. Once done during the procedure, this is a procedure that we do under intravenous sedation at our center, and the procedure may last for up to 2 to 3 hours depending on how soon we find sperms. We do it in a way that we do not affect the vascularity of the testicle, though you may have some pain, some discomfort for a few days following the procedure, for which we give medication. Following the procedure, there is restricted heavy activity and heavy exercise for a few weeks, but you are allowed normal activity within a few days' time. And most men will recover very well. If someone has a very low testosterone to begin with, then a MicroTESE procedure will also further perpetuate or increase that deficiency, and you may need testosterone supplementation later. So that's something that all patients are counseled beforehand, so that they understand that if they have low testosterone to begin with, they may need replacement later. Most patients will recover completely from this procedure. Most patients do not require a secondary procedure. Sometimes, if you've had a successful MicroTESE, but the IVF has not been successful, you may plan a secondary MicroTESE procedure after 6 months. If this is not successful, that's usually considered the finality of procedure, and then you should consult your fertility doctor for further options regarding fertility.